Hey everyone, this is Dr. Anna Navita Dolopo. I'm a doctor of acupuncture and Chinese medicine, and I'm board certified and licensed. I've been in practice since 1999. You can check out my work at elementsinharmonyacupuncture.com. I'm very happy to share that I have 3 doctors that help me out here. They work here, Dr. Shore Omidi, Dr. Hope Lin, and Leilani Navar. She's a board certified and licensed acupuncturist as well. You can check out their work if you go to elementsinharmonyacupuncture.com. At the top, you'll see healers. Check them out there. We also have an amazing massage therapist. She's also a neuromuscular sports therapist. Nicole Davidson and I have known each other since 2003 when I used to work as a massage therapist at Burke Williams in Mission Viejo. So I've been licensed since 1999. I've been seeing patients since 1999. And yes, I've treated many cases of tinnitus. You can pronounce it tinnitus, which is a more formal way to say it, or tinnitus, or just call it ear ringing. So I'll probably go back and forth in those 3. I have grown up saying tinnitus, so I'll just say that. So I'm 48 now, and I have not had any incidents of tinnitus since I was 20, when I started receiving acupuncture and Chinese herbs. So when I was 20 years old, that's when I started studying Chinese medicine and started receiving it, acupuncture and Chinese herbs. I've been receiving acupuncture at least 1 to 5 times a week for the last 28 years. I grew up with tinnitus and it sucks. I think that's my second time saying it. There are support groups for it. It can be very easy to treat. It can be very difficult to treat. So in this particular video, I want to share a little bit of insight in some medications that may cause tinnitus. I think it's very important for me as a doctor of acupuncture and Chinese medicine to share what I can do and can't do when patients come in. I like to set my patients up for success. When they come in, I look at what's going on. There are 2 subsets of tinnitus patients. Those who come in with other health issues, and tinnitus happens to be a symptom that I also need to treat. And then there are those people who come in specifically because their quality of life is really affected by the ear ringing. And this week, a 68-year-old gentleman came in weaker in constitution than he had been in previous decades. 68 is very young, and he's just not feeling strong. He has the ear ringing, he has dizziness, he has some weakness in the legs, and other issues, and he's on a lot of medications. So I looked at the situation, and I looked at his what we call constitution, and I just really had this feeling that before I saw the medication, that this particular condition may be caused from medications. So I asked to look at the list of medications, and sure enough, there were quite a bit, and I wanted to go down through the list of medications online to see if tinnitus can be caused by any of those medications. The first 4 medications he'd been on for at least 10 years. Why am I sharing this? Because through the years, this is my 24th year in practice, I have learned that there are some things that I can heal quickly, and there are some things that I may just help with the quality of life. And what I mean by that is, as long as they're on that medication, there's only so much I can do. The medications that are prescribed by their medical doctor, that is for them to discuss. And that is for the doctor, for he or she to decide whether or not to keep that patient on that medication. All I'm here to do is to listen to the patient's chief complaints and see if I can, realistically treat that person. When you look at my other videos, and if you look at the other testimonials, Dr. Lopo can help with tinnitus. Well, yes and no. It just depends on the situation. You can give me 50 people with tinnitus, and maybe I may significantly help with 30 to 50% of them, depending on the cause. You hear me say in other videos, I can help 80, 90%. In this case, it's a lot more complicated in this particular condition. And in this case, I took 3, 4, 5 at 14 points the font. Some notes that I shared with the patient's daughter, how the tinnitus is probably, in my opinion, cause by at least 90% of from the medication. So the list is, I'm probably going to pronounce these all incorrectly, so I apologize. There are 9 medications. Clonidapril, and then rosuvastatin, levothyroxine, carvedilol, dutasteride, sulfanicin, carbidopa-levo, and bupropion, and meclizine. So we're going to go through as quickly as possible the medications that can cause ringing in the ears. He also has dizziness and a few other things. So this particular medication is an ACE inhibitor and angiotensin receptor blocker. So he's got an ACE inhibitor, so it stands for angiotensin-converting enzyme. So it says here, this article was published by licensed pharmacists, and Joshua Murdock is licensed pharmacist in Arizona, Colorado, and Rhode Island. So I found this article, Medications That Can Cause Ringing in the Ears. Also, Tinnitus, written by Austin Ulrich, and he's a pharmacist, licensed pharmacist, and it was reviewed by Joshua Murdock, who's also a licensed pharmacist. So just to let you know about Joshua Murdock, PharmD. He's a licensed pharmacist in Arizona, Colorado, and Rhode Island. Completed fellowship training in drug information and patient safety. Founder of Pharmacist Consult, an online resource for consumer-facing drug information. Published author in multiple academic journals. Preceptor for pharmacy students from Butler University and the University of Arizona. So, you can find this at goodrx.com/drugs/size-effects/these-11-prescriptions-may-cause-ring-the-ears. I'm going to put all these links in the YouTube channel, and if I'm posting anywhere else. So it says here, ACE inhibitors are medications used to lower blood pressure, but they may also cause ringing in the ears. These drugs typically end in, quote, IL. Common examples are lisinopril, enalapril, and ramipril. So when I looked up this first drug, clonidapril, that was it was one of the drugs that they consider to be an ACE inhibitor and angiotensin receptor blocker that may be causing ringing in the ears. Now, these are the notes that I'm sharing with the patient and his family so they can talk to the doctor who is prescribing all of these medications, because I have to be realistic. They're coming in for me to treat the patient for the chief complaint of tinnitus. Well, if I don't address the side effects that can potentially be caused by the medication, then how much is acupuncture going to do? As a Chinese herbalist, I'm not discussing any herbs because there are already 9 medications. We're not going to do that. We're not going to add herbs because I don't know what can possibly, I don't know. I don't want to add to the mix. I don't want to add to 9 medications. I don't want to make anything worse. So if I'm going to heal this, or at least increase the quality of life, if I'm going to have any impact on the tinnitus, then it's got to be from acupuncture, as well as making sure that healing with whole foods, that we're going to be discussing. We've discussed what foods to eat to help with the tinnitus. So that's the first one. So the second drug that this gentleman's been taking for over 10 years is rosuvastatin. So when I looked that up, let's see. So this is what I found. And this is on the pubmed.ncbi. So this is the National Institutes of Health. You can find this on PubMed. I'll be putting this link. This is a study, effect of statins on hearing function and subjective tinnitus in hyperlipidemic patients. Conclusion. So you can read the entire article on your own on PubMed. Statin group of drugs can have a positive effect on the hearing functions and subjective tinnitus. In particular, it is seen that rosuvastatin group of statins has a more notable effect on tinnitus. It was considered that further studies with larger patient groups are needed. So, let's look that up. What do they mean by that? So I look up, this particular drug, rosuvastatin, cause tinnitus? Statin drugs. So this is tinnitusformula.com. Statin drugs are very expensive and come with significant side effects. This is promoting CoQ10. Statin drugs often prescribed to lower cholesterol come with significant side effects. Learn how tinnitus medicine can reduce these side effects. The CoQ10 connection. Medications that can cause tinnitus. There you go. America's Pharmacy. So, tinnitus refers to ringing in the ears that does not come from an external source. Tinnitus can sound like buzzing, ringing, humming, and even shrinking. So, some people hear high or low pitches. It affects about 15 to 20% of people, according to Mayo Clinic. This is on americaspharmacy.com/blogs/medications-can-cause-tinnitus. It affects some people hear high or low pitches. It affects about 15 to 20% of people, according to Mayo Clinic. Fortunately, tinnitus is usually not a sign of serious condition, but can be bothersome and can accompany anxiety or depression, which this particular patient does have. Causes of tinnitus include hearing loss due to age, ear infections, inner ear damage, and muscle spasms. So let's go down. Cholesterol medications. Statins are a class of medications that are used to help lower cholesterol. Atorvastatin, also known as Lipitor, is a statin that slows down the liver's production of cholesterol. Although rare, some statins, like atorvastatin, can lead to or worsen tinnitus. Some ACE inhibitors may also trigger tinnitus. If you suspect your tinnitus is a result of one of these medications, contact your doctor. Do not stop taking any medications on your own. Your doctor may be able to prescribe a different medication or provide symptom relief for tinnitus. For most people, drug-induced tinnitus is a temporary and goes away once they stop taking the drug. So it's important to so what is that, so we're basically saying this can cause, this particular drug can have an effect on, it can cause tinnitus. Let's see, going back to the PubMed. Now, when I read this article, effect of statins on hearing function and subjective tinnitus, do they mean that, so let's read introduction. It is known that hyperlipidemia reduces hearing functions. In this study, we aim to study the effect of anti-hyperlipidemic drugs on hearing function and tinnitus. Let's see, methods. So it talks about the methods, and this particular drug, rosuvastatin, were included in the study. All patients underwent pure tone audiometry before starting treatment. Patients with tinnitus were evaluated by Tinnitus Severity Index and Visual Analog Scale. In the 6th month of therapy, otologic examination, pure tone audiometry, and tinnitus evaluation of the patients were repeated. So in the results, no significant difference was found in the pure tone averages of the patients before and after statin. However, it was found in the audiometry that audiometry, that after statin use, all drugs cause to statistically significantly decrease in the hearing thresholds at 6,000 hertz. Also, a strong increase was found in the speech discrimination percentages after treatments in patients using rosuvastatin 10 milligrams. A significant decrease was found in the tinnitus frequency, duration, severity, and degree of the annoyance in patients using rosuvastatin. So that's very interesting because this article is saying that it can have a positive effect, but then all these other articles are saying that it can cause tinnitus. So I'll let you decide for that particular drug what that means. So let's go, so kind of contradictory information there. When I looked up levothyroxine, the drug itself, I did not find that it can cause tinnitus. But what I did find was that low functioning thyroid can cause tinnitus. Well, I explained to the patient how that coincides with how we see ear ringing in Chinese medicine. The ears are ruled by the energy of the kidneys in Chinese medicine, and the energy of the kidneys also rules the thyroid. So if there's a low functioning thyroid, there has to be an issue with the energy of the kidneys in Chinese medicine. So is it caused by the drugs, or is it caused by the low functioning thyroid, with low functioning or energetically low functioning? So low functioning energetically of the kidneys in Chinese medicine. And he said, the doctors say nothing's wrong with my kidneys, but I feel, is what he said, that my kidneys don't feel strong, but no one wants to do anything about it. So I wanted to point that out. So we'll pass that. The next drug, and I talked to him at least 30 minutes on that. Carvedilol is a different drug. We'll talk about that. Types of medication that cause tinnitus. All right, this is on healthline.com/health/medications-that-cause-tinnitus. #Accutane. So I don't know what that's all about, but that's the link. Some beta blockers, such as Coreg, also known as carvedilol, are associated with hearing loss and with tinnitus. Other beta blockers, which may occasionally have tinnitus as a side effect, include bisoprolol and nebivolol bistolic. So I shared that with him. So the fourth medication, carvedilol, he'd been on for at least 10 years. So the rest, the next 5, 6, 7, 8, 9 drugs he's been on under 10 years. So we'll go with the next drug, which is dutasteride tamsulosin, side effects by likelihood and severity. This is on WebMD, and I'll put the link because it's pretty long. Now, tinnitus is not discussed as a side effect, but the patient does suffer from dizziness. So, if experienced, these tend to have a less severe expression. Problems with ejaculation, a stuffy and runny nose, backache, dizziness, headache, diarrhea, generalized weakness, which the gentleman does have in the legs, altered interest in having sexual intercourse, the ability to have an erection. Now, this is very important because if you see some of my videos, I just did a video, I'm doing a series on men's health, specifically on sexual health. We'll be discussing prostate health issues. I've done a few videos on what turns men on. I'm treating a gentleman in his early 70s specifically for erection. So I take men's health, especially their sexual health, very seriously here. It's probably not fun for a gentleman to not be able to have an erection in his late 60s or 70s, especially if he is romantically involved with someone, or especially for the woman who is romantically involved with him, if it's a heterosexual relationship. So I just wanted to share that particular aspect of that particular drug. So I'm just kind of breezing through these things, but I just want to let you know this is what. So some of the things that we see. These are the drugs that this gentleman's taking, and I want to make sure that these drugs are going to be discussed with his physician. So the next drug is sulfanicin. Okay, so, when I looked up, they asked a question about renal disorders, so kidney issues. So I found on National Institutes of Health, drug-induced renal disorders. So I'll put this link. It's a long National Institutes of Health. That's a government website. Drugs can cause acute renal injury, intrarenal obstruction, interstitial nephritis, nephrotic syndrome, and acid-base and fluid electrolytes disorders. Early detection of drugs' adverse effects is important to prevent progression to end-stage renal disease. I have a woman who's in her 50s who is at 10% kidney function. She is on a waiting list for a kidney transplant. She does not want to have a kidney transplant, and she does not want to do dialysis, which she's probably going to end up having to do unless I can change things around. Because her mother had dialysis and her mother had kidney failure, and her mother unfortunately passed away. If you go to elementsinharmonyacupuncture.com, and if you go, where is my website? So this is my third website. If you go to cases, go to kidney disease stage 4, you can see how in 1 month and 7 days, I got the EGFR from 30 to 90, went from kidney stage 4 to kidney stage 2. I'll let you watch that video there. So, I couldn't find anything on sulfanicin, but I did go to the next one, number 7, carbidona levo. So, carbidopa and levodopa and tinnitus, a phase 4 clinical study of FDA data. So this particular link I will put, it's on ehealthme.com. This is pretty easy, /ds/carbidopa -levodopa/tinnitus. Gender of people who have tinnitus when taking carbidopa and levodopa. Females, 33.33%. Males, 66.67%. So I shared that. So we'll go on to the next drug. So you're starting to see that I didn't have to go far. These were all first page. Bupropion. Okay. This was on psychiatry and clinical psychopharmacology. It's a very long link. I'm not going to share that here, but I'll share it in the links below. Tinnitus caused by bupropion is most likely due to dopaminergic enhancement. Tinnitus perception is processed in the prefrontal, primary temporal, and temporoparietal associative areas, as well as in the limbic system that overlap cerebral dopaminergic projections. So it's saying that tinnitus can be caused by bupropion, and the cause why. So the last drug is meclizine. All right, so when I looked it up, meclizine, it's the generic name for antivert. So antivert side effects center. This was written, the medical editor's medical doctor, Melissa Conrad-Stopler. So Dr. Melissa Conrad-Stopler. This was last updated on the prescription list on October 20, 2020, 2 years ago. What is antivert? It's an antihistamine used to prevent or treat nausea, vomiting, dizziness, so he has dizziness, caused by motion sickness, and can be used to reduce lightheadedness, dizziness, and loss of balance, also known as vertigo, caused by diseases that affect the inner ear. Antivert is available as a generic drug and should be taken by mouth with or without food or as directed by your doctor. So lots of drugs, and I basically wanted to share that what I did during this particular consultation was to go through the drugs and could they possibly be caused by or be causing the tinnitus. Can acupuncture help with tinnitus? Yes, absolutely. Can herbs help with tinnitus? Yes, herbs can definitely help. The right herbs. Can foods help with tinnitus? Absolutely. But we have to find a way where we can work harmoniously with this patient's doctor, his primary care provider, and show the papers that I provided on all the prescriptions and that they can possibly be causing his ear ringing. That is every day, pretty much almost all day, low grade, for the last 6 months. And we'll do the acupuncture, but if I don't do my due diligence and share that yes, this may be caused by the drugs, stay on the drugs, do the acupuncture, and then we find out, the acupuncture doesn't work. It doesn't work that way. My biggest pet peeve is for someone to say the acupuncture didn't work. No, we have to know what's causing that particular condition, and we need to work as a team to find out what we can do to increase this person's quality of life, because 68 is very young. I'm 48. I'm 20 years away. I hope when I'm 68 that I'm not feeling like an old lady. I see patients in their 90s or hundreds, obviously early hundreds, and I plan on living for a long time with a high quality of life. So the purpose of this video was to share with you just some of the drugs, or the drugs that he's taking, and how these particular medications may possibly be causing the tinnitus. I could be wrong, but I didn't have to go very far when I went online to see what was going on, to see what they said online. Again, the first one was from a pharmacist who wrote that article. The second one was on the National Institutes of Health, but that was kind of like maybe it could be helping. But then when I went on a different website, it's saying that statins can be causing the tinnitus. One was on Healthline, one was on WebMD, one was on the National Institutes of Health, one was on ehealthme.com, one was on Psychiatry and Clinical Psychopharmacology, and one was directly from written by a medical doctor, Dr. Stobler. So I think these are credible links, credible sites. I'll be sharing them. And so just to let you have some insight on tinnitus and drug use, pharmaceutical drug use. All right, have a great afternoon. If you'd like to visit us, it's elementsinharmonyacupuncture.com. We have 4 licensed acupuncturists who work here, and an amazing neuromuscular sports massage therapist. Take care.